Welcome to The Consult Before the Cut, your go-to podcast for all things anti-aging, aesthetics, and plastic surgery. I'm Dr. Jonathan Weiler, a board-certified plastic surgeon with over 15 years of experience.
I am Taylor Besh, physician's assistant and expert injector at Weiler Plastic Surgery.
And I'm Brittany DeSherry, nurse and COO over at Rejuvime Medical. Each week, we'll dive deep into the latest trends, expert insights, and real stories from the world of beauty and wellness. So grab a seat at the consult room and let's discover the secrets of timeless beauty together. Hey everyone, welcome back to the Consult Before the Cut. We are here today and we are going to talk about some fun stuff.
Yes.
But before we do that, I would like to thank Rejuvime Medical, our lovely HRT, GLP-1, longevity, all of the medicine that you need and the therapies that you need to keep living that best life of yours. We are all over the state of Louisiana and in the Gulf Coast, Mississippi region in D'Iberville, Mississippi. We have many, I think up to 17 nurse practitioners now that can help you on your journey to that longevity that we're all chasing after. And then, of course, Weiler Plastic Surgery Group, the largest plastic surgery group in the state of Louisiana with 5 board-certified plastic surgeons, a whole bunch of fantastic expert injectors, such as Taylor Besh over here, and then all the estheticians to keep you that glow and looking your best self. They are all over South Louisiana.
Yep.
Yes.
Yep, all over South Louisiana.
From the east to the west.
East to the west.
So we would
I feel
love
Brittany's
to thank them.
bringing it today.
I am feeling really
The
good.
excitement, let's
Mainly
go.
it's the prednisone.
And the colors.
It's the prednisone.
The Mardi Gras
and
colors.
I know this is going to air after my favorite season of the year, but guys, we are in the thick of it. We are in the thick of Mardi Gras season. We are getting to this, like, what do they call it? The deep Mardi Gras. This is deep Mardi Gras.
The deep Gras.
It's deep Gras. Because you're going, I mean.
Oh, yeah. I'm about to get my groove on, right? So I ride. I used to be a huge Mardi Gras.
I was about to say, you were tame in your young age.
Oh, I was a huge Mardi Gras person. But living in Baton Rouge, which is, in my opinion, a little bit of Mardi Gras light.
Yeah, it's not great.
I still go down with the old guys and go down to New Orleans and I ride in Bacchus, the best parade.
Are these your Jesuit bros?
These are, even further back. These are guys that honestly, like the 4 guys that I primarily ride with. Now, there's a bunch of brothers and sons involved, but met all these guys in kindergarten. We all grew up in the same neighborhood.
That is cool.
We all used to ride. This is back in the bike riding day. We used to ride bikes.
In the neighborhood. And the street lights are on. It's time to come home.
That's cool.
Wait, does Barrett ride with you?
He will probably ride next year. So 2 of the guys I ride with are bringing their sons for the first time.
Oh my gosh.
So most guys will bring their sons either like senior year of high school or freshman, supposed to be 18 to ride. Now, Barrett did ride as a page.
Yeah.
Right?
Yes.
So a page is like, they have the king, right? Sits on the throne on top of the float, and the little pages are all around him. And we thought Barrett did this maybe like 4 or 5 years ago. I thought he was going to be like intimidated because there's literally a million
It's
people.
insane.
And like once you start, it's like, right? It's just a constant. So he got on it and he was like in hog's heaven. He asked all the time, when can I ride? How old do I have to be? And I'll never forget, he did it with the dude that was singing the, he was the musician. His dad was on Family Ties or not.
Rob. Hey.
Yeah.
Of course.
It made that model very famous. That
Rob who?
Robin Thicke. Robin Thicke. Look at Max.
Robin Thicke. Tell Grace she's no longer needed.
Yeah, so Robin Thicke rode, right? He was the king, and then his son was around the same age as my son. And so my son gets on, and like, so the king is up like maybe like 8 feet, right? And so we're watching my son, and people are like, ah. And so he would be like, Robin, this kid down here needs a bean.
Wait, Barrett was
and like he's like, what? He's out there. He was like sneaking his vape. Like, what? Give him something.
Just throwing stuff.
And they follow the king float, so it's unlimited throws. The pages, so they follow it with a truck, and they just load.
And they just reload
constantly. And I mean, he was like, it's like a 3.5 hour ride. I mean, he was like jazzed up. He loved it.
So y'all have already loaded up.
Oh,
everything's ready to go. You just show up.
Yep.
Your handler is going to take you to New Orleans.
I'll get a handler there and a handler back.
And that is Sunday.
So
That is Sunday
I
night.
drive in Sunday morning and I leave Monday morning very, very early, like 1 a.m., 2 a.m., come back.
My
And then
God.
usually I go on a trip afterwards,
I
which
know.
is like Monday morning. Like
Hence the reason for the handle.
Yeah. Yeah.
I've like,
Sir.
hopped on a plane and flown. I used to go skiing a lot. We're going to Universal because my little daughter's in the band and they're marching at Universal. So I do get a 1-day recovery. Normally it is
Straight
straight through.
from the
And I have
ball
got some
to the
stories.
airport.
Yes.
I was about to
Like-
say, in his younger days.
In my younger years.
Well,
I have got some stories.
Tonight,
Barely making it.
tonight's muses.
Oh yeah.
Tonight's
Big parade.
muses. Tonight is the shoes.
Shoes?
The
Okay.
shoes.
The shoes.
The shoes.
Okay.
It is the shoes tonight,
Yeah.
and so
And they only have a certain amount that they throw. Like they throw beads.
yes, and
And then every once in a while, you'll like get lucky and get a
They
shoe.
make their own shoe.
yes.
Okay.
So I feel like a lot. So like Muses has their own shoes,
Mhm.
and so they decorate these shoes. And
Mhm.
yes, it is amazing when you get a shoe. And then if you let's take Iris for example. Iris is sunglasses. Iris makes the sunglasses.
Yep.
And when
then,
is
of
that?
course,
Saturday
that's
during the day?
Saturday during the day.
Okay.
And they
Beautiful
call it like it's Sat Her Day. So SAT, and it's like the
It's
big
a
her
women's
because it's a completely
Okay.
women's
Mhm.
crew. And so
Fun.
so Saturday rolls before Endymion.
Mm-hmm.
Endymion's the other like really big
Big mega crew, right?
big mega crew in New Orleans, and then Sunday it's Toth, right? Toth Sunday.
Yep, Toth Sunday too.
And that's the toilets.
That's
No,
no,
that's
no,
Tux.
that's Tux.
Oh,
That's
Tux.
Tux.
When is that? Sunday.
Saturday
Oh,
during
okay.
the day. So there's a ton of
Oh my
parades
gosh,
going
y'all.
on.
So many.
So Toth and Tux and Iris ride the same route but at different times.
Yes.
And I think Iris goes 1st, then Tux.
Iris
follows
is in the morning.
Okay.
And they all have different flavors. So Tux is the toilet bowl humor, right? They have a giant
Right.
toilet.
The
they throw
toilet
toilet
paper
paper
everywhere.
They'll throw some dirtier items
Yeah.
off the floats. There may be some balls that are blue.
The blue balls, the Barrett blue ball
Oh,
story.
yeah.
They'll throw a toilet seat, the plungers.
Yep.
And then Iris, I think Iris is sophisticated, very nice.
It's-
ladies, very pretty during
Yeah.
the day.
It's beautiful. So you know how we all dress up for my birthday and we go to New Orleans and everything like that. Iris, a lot of them, they do the same thing. They all have on their Iris outfits. They go do the lunch
Yeah.
they go do the lunch in the quarter and everything.
Yep.
You could see the
How
entire
much fun.
like Irish
They
crew
toast
and
with
all of their
the
stuff.
all male crew, the Hermes crew. They
Yep.
meet on Friday and toast. So
cool.
I took
So
a
many
whole
traditions.
semester of Mardi Gras. I went to high school in New Orleans. We had a whole semester of Mardi Gras.
the history of Mardi
History.
Gras.
Well, maybe it was 2 months. It was two. We
That
like
is
in our
so
it was our LA
cool.
history, Louisiana history class, and we
Mhm.
broke and we took like 2. We went through. I mean, I love Mardi Gras. Is fascinating. It's a fascinating.
Yep.
Wow.
Somebody just asked me at lunch when we went to the hospital for lunch. No big deal. It was delicious. No, but somebody asked me at lunch, Brittany, why do you love Mardi Gras so much? Like, why is that like your holiday? And I'm like, because there's just something about Mardi Gras like that I love. For when I was younger, I absolutely loved it. Absolutely loved it. I think
Yep.
it's a very carefree time. I think
Yep.
everybody is just happy
Mhm.
during this time because it's just like this big happy thing. And
Mhm.
I was like, even though I've gotten older, I'm like, I want to keep that going for my kids.
Yeah.
And because my kids love Mardi Gras
Mhm.
so much, because they do too. Yesterday in the neighborhood, there was a band a school band
Mhm.
that marches in South Downs tomorrow night. And it's a school bar in our neighborhood. And they were marching and they marched down our street yesterday. My kids are running outside, dancing in the
So
driveway
awesome.
as this like high school band is marching down our street, but they were practicing the route for tomorrow
So
night.
fun.
And it's just like, because it's just fun.
It's just fun.
It's just
At
Good
fun.
old
at all
Louisiana
levels.
culture.
And
yeah.
there's zero
Baby,
commitment.
Toddler.
Yeah.
Kids, teenagers, and everybody's you enjoy it in a different way, right?
Yeah.
The purity when you're a kid,
Mhm.
getting all the throws. You're sort of a young 20 or teenager. You're drinking and enjoying.
Yeah.
Yep.
You get older, just seeing your kids out
Yeah,
there,
yeah.
and then it's just fun,
yeah.
man.
I love it.
Yeah.
And I don't ever go to New Orleans. I
Mhm.
don't go to New Orleans for Mardi Gras. I do more of like a Bayou Mardi Gras
Mhm.
because we do Thibodeau, Homa, Lafayette. We do all those, which are completely different, but the same.
Yeah. Yeah.
It's still like that same environment.
Yeah.
So I'm like, I just love it.
Well,
That's our spiel
if
today.
our hormones are optimized,
I know. I'm
You're
like,
having
thanks
fun.
for joining.
You need
We'll be
hormones.
checking out for the next week. No, yes. Well, you're gonna have to be able to keep up.
yeah, truly, you got to optimize
need a
those
little,
hormones.
You're gonna need a little help
You need a little help.
because I can promise you, an IV is not going to get you to the next level. So today, what we are talking about is pellet therapy, hormone pellet therapy, the truth about pellet therapy. And I absolutely adore pellets for patients that are like, obviously you can do female and male patients, that you have it for both. And we at Rejuvime, we've had both. It's far more prominent in our female population than it is our male, because with the males, females can get 1 pellet and it'll last them 3, anywhere from 10 to 12 weeks. Males will typically need about 10 pellets. And when I say pellets, I kid you not, guys, it is like the size of a grain of rice.
Yeah, tic-tac, rice grain.
Yeah, like it's so small. And that's just the testosterone. When it comes to females, when we start talking about estrogen and progesterone pellets, it's like the top of a pin. Like,
okay,
it's
but
so
I feel like
tiny.
you're jumping the gun.
I know, sorry. Okay.
But I also think the reason to talk about...
What the heck is a pellet, too? That's like what I want to go back to. Yeah. Go ahead.
I think the reason to talk about this and to really deep dive into pellets is hormone therapy is huge for both men and women. Obviously, with them releasing taking the black box label off, the FDA and society has sort of waved their magic wand too late and said, okay, now hormones are okay. So I think, especially with TikTok and Instagram, you get all these opinions, right, of what's the best way to do it, right? I'll be honest, there is no best way to do it.
The different modes of,
that's
of delivering.
It's delivering a re-education of how you can get it. There's so many ways. So many different ways.
Right. And I really think this episode will hopefully break down the myths of pellet therapy. We'll talk about what it is exactly, what's good, what's bad, because it's not perfect, right? There are other delivery methods of hormones, right? And why it's so important. But just to talk about hormones, I think hopefully it's only been a few months, maybe 2 months since the FDA took off their little black box warning. But hormones are they're just so important for quality of life, longevity, weight management. It's all about enjoying life, and I think hormones as you get older are just really essential to that.
Well, and earlier Dr. Weiler and I were talking because we had a cardiologist this past week say that he is probably one of our biggest referrals. Yeah. He refers a lot of patients over to us for GLP-1s for heart health in conjunction with hormone therapy, because it kind of helps with the cardiovascular health and everything, when you're talking about hormones of both men and women. Right.
Well, I think about this all the time. So obviously I'm a practicing plastic surgeon in my spare time. This is my true calling, and where I make all my money. This kid, this is my money.
This is his hobby that you're just jumping into.
This is my side gig.
Flushing money down. No. So I have an employee that recently fell playing with her dog, and she's in her 60s and had a compression fracture of her vertebrae. Right. So that's where, as a woman postmenopausal loses bone density because of hormone loss and loss of muscle mass. Right. She just fell, like playing with her dog, fell backwards a little bit inside of her butt and had a compression fracture, severe pain in one of her legs and all this stuff. Right. And she hasn't been on hormones, and she's very well educated. She's an anesthetist and very educated lady, and not been on hormones because of the fear of, black box warning and all the associated issues. And then I'm lying in bed last night, watching TV, the Olympics, love my Winter Olympics. And they have the commercial for hot flashes, and so, they play the commercial, relieve all your symptoms of the hot flashes, and then the side effects, may cause brain cancer, may cause, may cause, all these things, right? That medication was developed because of people's fear of hormones, right? Because of the misinformation out there, right?
I was going to say the ignorance.
There's a whole line of medications for osteoporosis, right? Once a year infusion, once a month infusion It's crazy.
It's
right?
fixing the symptom, not the cause.
Correct.
Mhm.
And so if you go back and fix the cause, which is the loss of, and our bodies are changing as
Right.
we grow older. Yes, like we're going to lose stuff. The reason that we are so, like we can take it when we're younger is because of all of the levels of the hormones and everything that we have in place and the, HGH levels that we have in our bodies and stuff like that we don't have when we get older. So just replace that.
Yeah.
Stop treating the symptoms of it.
And then fear has driven.
And I
women
think
not
it's
to
big
take it.
pharma too.
And big pharma.
Yes, I think
Well,
it's
fear propagated by big pharma and government.
correct.
Yes.
Correct.
And
So, what hormones are you looking at, and what are the delivery mechanisms for hormones? Yes, we're going to focus on pellets, but tell us the other options.
I mean, there's so many. So we have injectable hormones, we have patches, we have pills, we have creams, we have pellets. I'm trying to think. Roz, am I thinking of it?
we're going to pull her in here and talk to her. But so think of this, and we're gonna break it down. Okay, so when you talk about hormones, it's primarily testosterone for men, and then women. You have the female hormones, which is estrogen and progesterone, and then you also have testosterone, right? And women need all three. Men do not need to supplement with estrogens. Hopefully, now there's a part of the community that may, but a traditional man, is going to be only testosterone.
Sometimes we have to block that estrogen out.
And sometimes we do, and we'll talk about
in
that.
males,
right? And sometimes we do because we don't want too much estrogen. But males do need estrogen.
Yes.
So we don't want zero, right? We want the appropriate amount of estrogen. And then it really comes down to delivery methods, and we're going to really dial down and talk about some pros and cons. I think of the pellet, because I think pellet therapy. I feel like pellet therapy. Maybe got my feed messed up, but I feel like pellet therapy was like super hot years ago.
I do too.
And I think now it's getting some beef.
Getting some traction?
Well, I think people
it
are
was more
bashing it.
Yeah.
You think
I
it's
think
more
it was
popular?
more popular
Yeah.
in the
Really?
past.
Yeah,
I think it's
do you
less.
I think people are beefing on it.
But once again, I think it's due to misinformation.
Oh, total.
I think that's what it is. And because for me, and I mean, saying like, we were just talking about this, I don't even do pellets, but nonetheless, this is like ideal. Like pellets are so ideal, especially for busy moms that are running and going, the consistency of them and everything they're great. They're great. You don't forget to take them because they're already in, you know what I mean? It's like for, the fast pace that all of us are living in, they're fantastic.
Right.
Well, I liken this, and I'm going to be very serious about this, but so some females or people that want to improve their appearance, if you come to our practice, you'll have the full spectrum of, all the way from a little laser or peel, injectables, Botox, all the way up to surgery, right? If you go to some place that it's a solo provider and all they do is X, well, then that's all that you're really going to get, right? And so I think you do have a lot of people on social media that maybe don't feel comfortable doing pellets, or maybe had a single bad experience with a pellet, and are going to start poo-pooing on pellets. But I think being closed-minded and not evaluating what's best for you is a mistake, right? And I don't know how you feel.
And I like the getting where you're supposed to be with other applications. And then once you have your hormones figured out and you're consistent, it's the not thinking about it. Like maybe you don't start with pellets. Maybe you do.
Yeah. You got to tweak it.
Get where you are tweaked-ish. And then it's out of sight, out of mind. You do a pellet and then you're good for 3 months.
Yeah.
Like that would fit more in my life than doing an injectable or a cream.
Yeah.
You don't want to do your injectable when you're exercising in the closet.
Correct. Correct.
Taylor.
Like a pellet is like, boom, done. Right?
I'm messing with you. I'm sorry.
Wait, the fact that she was like, so now my son is in the closet. No, but I mean, that's
truly.
that's absolutely it. And of course, like in that perimenopausal phase in your life, you're all over the place.
Right.
So maybe that consistent therapy is not going to be for you at that time. And maybe that's where the beef is coming from, is that like, oh my gosh, like I had this done and my hormones are all out of whack.
Right.
If you're in that perimenopause phase and you're going all over the place and you need to adjust to be able to take, what your body needs at that time. Yeah, pellets maybe not the best option for you.
Right.
If you are postmenopausal at this point and you ain't got nothing kicking anywhere, yes, like we could probably start with pellets.
Yeah.
So it's just different. And like you said, it's about what's right for you during like what works for you, and you're right. Like most of the women that we have, I will say, do y'all remember when Miss Pam
Oh,
came back? She talked to us about that. She travels all the time because her kids are all over the country. She travels all the time. So she can put a pellet in and be gone for 3 months.
Yeah.
Pop in for a quick appointment when she's in town, get another pellet and hit the road.
That's amazing.
You don't have to make sure that you have stuff packed.
Yeah.
You don't have to make sure
shit,
that you have a refill.
Yeah.
You don't have to make sure that you forgot, like, I left my face wash at the hotel the other day.
Right.
Just stuff like that. You know, it's like you don't, and so sometimes this works for that lifestyle. And
I want to talk to Rosalind about the process. Right? Like, how do you, I don't think anybody's coming in asking for a pellet either. So why are you asking? Really?
You'd be surprised.
Okay.
Wait, you said you don't think someone comes in asking for a pellet?
I would not go in and say, okay, I'm interested in pellet therapy.
Do you want to know why? The group text. The group text makes other people interested in what.
Yeah.
So if I tell you, Taylor, I've been doing pellets for years. Can't get enough. I absolutely love it. I don't have to think about it. I don't have to worry about it. I don't have to do anything like that. And I tell you that, then you have that seed planted already. So when you go and you say, oh, my friend does pellets.
Yeah.
And she absolutely loves it because it's out of sight, out of mind. And so it's like, that's where, you'll find people say like, oh, is that an option to where I don't have to take a pill? I can't remember to take my medicine on a regular basis.
Right.
Yeah, I think that's something. I also think the social media rabbit hole, I'm sure as a provider, you get people come in and said, Taylor, I want 0.3 cc's of Voluma right here. Right?
It drives you crazy.
Drives you crazy, right? You're like, oh, that may work on that person, but it's going to work on you, right?
But I really do feel for girls, we talk about, like, we're like,
girls,
hey, and I think that's where it at least plants that seed, like, oh, that's an option.
Yep.
Because I don't think that everybody knows that it's an option. And
right.
So when somebody says that it is, it's like, it kind of lights it up. Now, yes, after that, are you going to go down a social rabbit hole regarding that? Probably.
Right.
I think that's kind of where we all, go look for it. But
there's a tragedy on the group text. One of my best friends' estrogen patch fell off and it was missing. And she's like, guys, who has an estrogen patch? Like, I'm going to go crazy. Y'all have to get me an estrogen patch tonight.
It's the black market estrogen patch. No, that's what it's like.
You're right. That's what I'm saying. You're right.
A pellet, it would not happen.
Yeah, you're right.
No, so we are definitely going to get into it. So if we can go ahead and bring Roz. We have Rosalind joining us again. She has joined us in the past. I think we did estrogen dominance with Roz. So she knows all the ins and outs about this. So stay tuned and we'll be right back with our expert.
My name is Casey. I live in Hammond, Louisiana. As I was approaching my 30s, I started to notice a few wrinkles here and there. I just wasn't happy, so I decided to make a step to change it. I've always known of Dr. Weiler's practice, and that was always my first choice. The first time I've ever been here, I was a little nervous, but once I got there, everyone was very welcoming, made me feel at place, and it's made me look visibly younger. I have more of a confidence boost. I feel better about myself and in my own skin.
So my hair had started falling out about 8 months before I saw Holly at Rejuvime. I had seen my regular doctor and he told me everything was normal, but my hair was falling out, so I knew everything was not normal. When I went in to see Holly at Rejuvime, she gave me all the information that I needed and told me the benefits, how it would help. It's not brittle and frail anymore, and it looks much healthier. It's not just about what's going to happen today or tomorrow. It's about years forward.
Hey everyone, welcome back. We have got our expert with us today, Miss Rosalind. Miss Roz, thank you for joining us.
No problem. Hey everybody.
Hey,
how are y'all
so
doing?
glad to have you back.
I know.
You're
You're
glad
back.
to be back.
No, she's not.
I am glad.
She fighted. She
is nervous.
She fought me. She was like, Brittany, she's
but
like,
you
this is my
kill it.
only one
I just
that
did
I'm
the
doing in
virtual event,
2026.
and I told her, I was like, okay, I did my
commitment.
Yeah.
I did my due diligence.
And then she calls me, what are you doing on Thursday? I need you. And I
you're
can't
like,
say no. I
right.
need a job.
Right.
Because that's what was on the line. I was like, you either do the podcast
Yes.
or you can find employment elsewhere.
Right.
No. So Roz, you've been with us for
Almost, no, a little over a year now, about
In
a year and
October.
3 months, October of 24.
October.
25.
Oh, yeah.
24. Yeah.
24.
Yeah.
Yeah, because you made your 1 year in October. You and your
Mariah.
counterpart.
Yes.
down there at the Baton Rouge Bluebonnet Highland Clinic. Her and Mariah started at the same time, and they are the two providers down
There's
there.
providers down there and providers
Correct.
across the street on Bluebonnet?
Yes.
Okay.
We have 5 providers in the greater Baton Rouge area, one of them being in Prairieville, but in Baton Rouge, we have 4 providers. We have 2 at Jefferson and 2 at
Okay.
Highland. Yeah. So
Got it.
if you're in the Baton Rouge area, we
Right.
have many providers that can see you and get your HRT done.
Yeah.
But so Roz, tell us a little bit about yourself again for everyone who missed the estrogen dominance episode.
Okay, I'm Rosalind. I work at the Baton Rouge Highland location. Been there a little over a year. We do hormone replacement therapy, weight loss, peptides, anti-aging, longevity. Love it. I love my patients. I love my crew. So, and I'm happy to be here.
So great.
Okay, but you didn't do HRT before this.
No, I was actually a NICU nurse for 10 years.
I
Wow.
didn't know you were a NICU nurse. My wife was a NICU nurse for 10 years.
Stop. At Woman's?
Yeah.
Well,
No, not
Okay.
Women's.
No,
at,
in New Orleans.
In New Orleans, at
okay,
Oxford.
okay.
We just have one of our new OR nurses is moonlighting, Megan.
Okay.
Forgot her last name. I know it's
We'll
Italian.
circle back.
Huh?
I said we'll circle back.
We'll circle back. I'm sorry.
No.
I went
You're
off.
like, ooh, her name. No, wait, so you NICU.
Brand
NICU.
spanking new nurse practitioner.
Yeah. And we learned something else very interesting this morning.
What?
I mean, what she eats for,
Oh,
what type of breakfast
Oh,
she eats.
y'all.
I eat dinner for breakfast.
Wait,
Mariah's
Rosalind?
going to get a
Breakfast.
kick out of this.
Rosalind does not eat breakfast food.
I do not.
She said that she had spaghetti.
We were doing like a little check to
A
make
mic
sure
check.
that mic check, and she said she had spaghetti for
I think
breakfast.
it's fascinating.
Yeah.
There's a lot of people
Pork
like that.
chops,
though.
rice
Yeah.
and gravy,
Yeah.
leftover barbecue.
Okay, but you've been on a pho kick.
Yes, I love
Oh,
You've
pho.
been making
yeah.
homemade pho.
I didn't know what you
Homemade?
just said.
She was like, oh, what do you know about my personal life?
No. I need you to like separate the words. Separate the words.
Okay.
Vietnamese pho
good.
kick.
Yes.
As in you have been making pho at home. Correct.
Rosalind wants to say cut.
I was like, all right, Britt, I know this is casual, but
It's very
yes, I
casual.
love pho. I make it at home. I go to the Asian supermarket.
Oh.
I get the broth, the veggies, the beef, the noodles, and
Yum.
it's so good. And it's so just warm.
Okay,
Yeah.
I might need to talk to you about that. My kids love.
Oh,
Yeah.
girl.
Okay, we
Life
need to chat.
changing.
Taylor, you need to be eating pho right now.
You
I
do.
know.
Yeah.
for-
I
When
know.
you're not feeling well,
She does
Yeah.
have a
And
Sun
hangover
May
cure,
Asian
for sure.
themed cup.
It's a mosaic. Okay, so we obviously brought Rosalind here for her expertise in pellet therapy because I know this is something that you love and you do in your
Yes.
clinic. But before we kind of get into that, so we were just kind of talking about the array of options that you have for hormones
Mhm.
in female and males.
right.
So, your female patients that are coming in and everything like that are getting them. And I mean, this, I guess, really applies for both female and male. But when you're putting the pellets in, how does it work? Like,
Okay.
And what
is-
describe a pellet is medicine.
Yes. So
A
it's
pellet
like,
comes from a
it's-
pharmacy.
Mhm.
What is a pellet? Break it down from like the very, very,
Top.
very
It
basic.
is. It's literally so small, like a rice-sized. Looks like a.
a piece of
I
rice?
guess no, not a piece of rice,
think-
like a pill, but a little.
like this.
It's a little pill the size of a piece of rice.
There we
Yeah.
go. There we go. Perfect.
Words,
Perfect.
Dr. Weiler. words.
Very,
You can't
very
do
small.
words.
And you can make that medicine
Bio-
exactly how you want it
Yes.
with
Well-
a compound pharmacy.
Yes.
Yes.
Bioidentical
Yep.
hormones, different doses.
And
We-
I think the ones that we use are cholesterol coated as well.
I believe so. Yes.
The ones that
yes.
we use are cholesterol coated as well. It also kind of helps with, I know you had some questions about some rejection of pellets.
Mhm.
Cholesterol coated pellets kind of have that less, the
Absorb
lower
better.
percentage of a
Yeah.
rejection. Yeah.
Better
Yeah.
absorption.
Mhm, mhm.
Okay.
The process is so easy. When I explain it to my patients, they are a little like, you got to slice me open. I was like, okay, let's start over.
Yeah.
It's a little tiny incision. And then we take our trocar, which is like a little metal tool. We pop the pellet in and we slide it right under the skin. We close it up with some glue, steri strip, and that's it. The process it takes to numb takes a little longer than actually placing the pellet. Yeah.
Yeah.
They
And when you say an incision, it's like your pinky nail.
Yes,
Like it is
very
the
short.
teeny,
Like a
teeny,
little-
tiniest
It's like
incision.
the width of the scalpel. Like,
Yeah.
you know
like
what I
you
mean?
can
Like
hold it
it's-
together with two fingers.
Yeah.
Like it's
Well, let's
I know.
Explain the process. So we're jumping around.
But
Okay.
now like that we kind of like, that's kind of like just the informal, just like how we put it in.
Right.
I want to go back to when people are coming in, what makes you suggest? Why would you suggest?
Well, so for our viewers, so think of this. So a pellet is a form of delivery of hormone therapy,
Right.
right?
Right.
And so anyone, whether you're male or female, and you decide to proceed with hormone therapy, one of the options to take it is with the pellet therapy, right?
Right.
And specifically the like you guys just said, it's the size of a grain of rice, right? It's a little bitty thing, and it's almost custom formulated, right?
Right.
So think of it as like custom formulated to the dose. Y'all all
There's-
making fun of me. So
No, because we just said all that.
I know, but y'all kind of was
Okay,
Just to
but-
recap.
maybe I zoned out.
This is the same reason I'm like,
I was a little
Josh, I
conf-
just
thought it
said
was a little
that.
confusing.
I just said that.
And
thought
I
it
didn't
was
include the
confusing.
numbing process. The nurses numb right before. It takes about 5 minutes.
I think the biggest thing that you have to make clear is that a pellet isn't just a pellet.
Correct.
Right.
Yeah, that it,
Wait.
and it's a custom dosage. It's not a pellet. This isn't a pellet. Like you said, it can have a combination of different medications in
It
it,
can.
right?
Estrogen, progesterone, testosterone.
At different levels.
And
At
it's like from
different doses.
12.6 or 12.5 milligrams to like 200 milligrams for testosterone.
right.
Yeah.
And everything
roughly.
in between. And I'm, when I say everything, I mean like 12, 25, 50, 75,
Right.
80,
There's a lot.
85,
Yes.
90. Like it kind of like stair steps that way to
Right.
where, it's
You can adjust the dose if needed, tweak it very largely or very small. I like that aspect of it. Sometimes it could be 5 milligrams that makes the big difference with feeling great versus, meh, I mean,
Yeah.
I liked it, but, could have been better. So I love that we have so many different dosing options to choose from when it comes to pellets.
Yeah.
So where does the pellet go?
So a pellet, we usually numb right on top of your buttock or hip area.
Mhm.
like right
Yeah,
There you
right
go.
there.
Uh-huh.
And then we numb it with some lidocaine, let it settle, and then we make the small incision, take the trocar and insert the pellet.
Uh-huh.
And then we remove the trocar and then apply some skin glue and a steri strip.
Could have just laid right here on the table and
Yeah.
let Roz do it.
Yeah.
Pellet real
How
quick.
It
long
is-
does that usually take?
Oh gosh, maybe 3 minutes.
Okay.
Yeah,
Okay.
very quick.
And then for the patient, they're in the office, 30 minutes, you think?
Yes.
About
So
30
we get them
minutes?
back there, we numb them, we chit chat, make sure they're feeling good if it is a prior patient. Do you like this level? Did you not like it? And then if we need to adjust dosing, then we will. But the process is very smooth. My pellet patients love pellets, but like y'all mentioned before, it is very patient specific.
Okay.
Different lifestyles. If they've had success with other routes versus pellets or didn't love other routes.
So let me ask you this question. If I come in and I say, Rosalind, I want a pellet, who's not a candidate? for it?
Okay.
Does that make sense?
Who's-
Who's a bad? What's a bad idea on a pellet?
Okay.
Somebody that doesn't bathe.
Oh my God. So,
In general,
okay.
Bad for society.
I'm in
much
a
less-
consult, first time consult, and I'm talking to my patient about hormone replacement therapy. And so let's just say she's done HRT in the past and she disclosed to me, I'm very sensitive to hormonal shifts. If my hormones get too high or too low, I feel it. I'm not really compliant with taking my oral medications every day or applying my creams every day, or I simply don't like injections, or I don't absorb creams that well. So that's when I'm like, okay, let's go the pellet route because you're already familiar with hormones, and it sounds like other routes haven't worked for you.
Who's not
Okay.
a good pellet person?
So who's
there?
not is going to be one who has trouble with compliance, one who has those hormonal fluctuation symptoms, such as headaches or palpitations, fatigue. It varies. Patients who want immediate relief because it takes a little while. It takes a little longer than our other routes. Let's see.
Because that's what, and when we talk about like she was saying that those hormonal shifts and stuff, like people that aren't consistent, that's like, our perimenopausal gals who are kind of still riding that roller coaster, because you have to think once you put that pellet in,
It's in.
that pellet's in.
Yeah.
There's no like, let me go dig it out. You know what I
Well,
mean?
that's
Like
what
if it
I
doesn't
think.
work.
If they want a lot of, I guess, autonomy with changing their doses very often, they're not a good pellet candidate because, again, once it's in for that 10 to 12 week period, we can't add to it or take it away.
Do you agree that it's not ideal for a brand new HRT patient who has never done anything?
If they're dead set on it, like you said in the group chat, they're like, I want pellets. That's what I want. Then I'm like, okay, well, let's do it. Otherwise, I would more so recommend an oral route or a cream or an injection. That way we kind of get a feel. Let's see what where you feel the best with your levels. It's out of your system much quicker. So if you don't like it, give it a few days. You're feeling better. And they're usually on board. And then I have my patients who started oral injections and they come back, they're like, I'm ready for pellets. I just want something a little more convenient, a little less upkeep, one less thing to remember.
Right.
So,
well, and that's what, like, when you talk about people that are like really good at it, me telling Russell, like, I can't remember to take my medication in the morning. I can't. So I know that I'm probably going to be inconsistent with oral medicine or anything. Like even my injections, I'll forget. I'm like, whoops, like totally forgot. But, in situations like that, it's a great suggestion for those. But you also have to, this isn't like a dip the toe. Like you're going to go ahead and get those hormones.
You're in.
You're in.
Mm-hmm. And then talk about how long that pellet lasts and just the absorption rate. Is it, peaks and valleys?
So typically they last about 10 to 12 weeks. The peak is usually around that 4 to 6 week mark. So that's when their levels are going to be at their highest. So for an initial pellet, we're going to check labs there and see how they're feeling when it's at their highest. That way we know they're going to be pretty good for the duration.
That's what I was about to say. That is a difference with pellets. So
you have to be compliant with your lab follow-ups to really enjoy all of the benefits of pellets.
It's extremely important because when we start patients on hormone therapy and stuff, we don't bring them back until like you want to, obviously like you're building up that levels if you're doing an injection or an oral or something like that. So you're not going to see those peaks until you get into that 10-week mark. And that's when you'll be able to look at those peaks. For pellets, it's completely different.
Yes.
Patients need to come in that 4 to 6 week mark after the pellet has been done. So all of the nurse practitioners that are treating you can have a true story in front of them.
Right.
Because if you're coming in 8 to 10 weeks after, you're on the downslope. Right. So when Rosalind looks at it, she's like, God, you look at it and you're like, my levels aren't great. Probably not because you're on the downslope. But if we would have checked it between that 4 to 6, we would have seen what your true peak is with your pellet. So that is a difference between the oral injection treatments versus the pellets is that follow-up behind it.
A very critical time period that we emphasize. Okay, we got to see you at this point.
And I think pellets are for, Rejuvime is great because that's all they really do is they focus in on the hormones. And so you have to be a savvy provider to be able to adequately dose and control. And like you said, see all the benefits, right?
Right.
Other modalities are a little bit easier to adjust, obviously. And they all have their pluses and minuses, but it always makes me cringe when if someone's, dabbling in pellets. Right? You don't want to dabble in pellet,
right. And we do have patients that follow up and their numbers look better, but not great for them.
Right.
So we give them the option, okay, you want to push your next pellet up a little quicker, more so towards that 10-week mark to get you quicker relief. And then usually recommend a higher dose as well.
Okay.
And then with each dose change, we're always going to get that 4 to 6 week lab follow-up. So you do have ways of kind of mending those gaps of not really loving your dose. We can kind of shorten that time period in between pellets to give you quicker relief. But
okay, so that's something else that I do. It's like you're on a pellet, amazing. Oh my gosh, amazing. It starts going away and then you can't get it for 10 weeks too. So it's like you feel so good and then you can feel yourself going low again.
Most patients describe it as the last 2 to 3 weeks I've been so tired. I can tell when my pellet is
Yeah.
wearing off.
Okay.
So I put in their chart, they're a 10-week pellet patient for
Okay.
sure. And we may need to dabble in the dose a bit because, yes, you're not going to feel that peak the whole time, but
Yeah.
I don't want you to feel that hard stop
Yeah. Yeah.
and have to just kind of deal with that for 3
Okay.
weeks or even 2
Yeah.
weeks.
And I mean, that's a really good point is people are going to metabolize medication differently. And as much as we say that it's going to last you 10 to 12 weeks, we have no idea until you get the pellet and we see what that course for you
Yeah.
looks like.
Yeah.
Because it is so different. I mean, we sit here and say all the time, it's a very, tailored to you situation. So like she's saying, there may be somebody, I know we've had ladies in the past that their levels are great. They're doing awesome. They only last 8 to 9 weeks on their pellets, but they are consistent in the 8 to 9 weeks. Like it doesn't fluctuate. And then they come in that 8 to 9 week mark and they get another pellet. And it's how they metabolize through it.
Rosalind, do you ever supplement pellets or is that taboo?
I have never supplemented pellets. I'm sure that's a thing.
Right.
Do a little research
Okay.
on it for
what,
sure.
What are you talking about?
Well, you can do so a lot of the ebbs and flows with the absorption, you could possibly supplement. It gets real tricky, but testosterone injections on top and things or patches and things like that, right?
More
you got to be
so
really
with
into it.
testosterone. I think testosterone would be
would be more of the things you could dabble in as opposed to
absolutely.
the estrogens.
Estrogen is a little more
A little tricky.
trickier.
Yep, I agree.
so wait, you would get a testosterone pellet, and then you would do injections
During the
as
wear
well.
off
yeah,
phase.
during the wear off, you could do some
Oh,
injections
yeah.
of
Okay.
testosterone.
Oh yeah, that
Yeah.
makes
To-
sense.
Like let's
supplement.
do weekly injections the last 3
Right.
weeks,
Yeah.
right before
Right.
your next pellet. So yes,
Right.
that is something.
Because
that
I
we
do
could
think, like you said, the trade-off with the pellets is it's a slower ramp up. It's a better peak and a more stable peak, but then it also goes down. Like
Yeah.
so, we would see this with I'd have ladies that come in and say, "Hey, I get a testosterone shot once a month."
I know.
Whoa.
Oh gosh, when they
Right.
tell me
And
that,
so,
I
like,
cringe.
yeah.
I'm like, you get how much?
Yeah.
I'm like, I bet you felt great
Yeah.
week 1, and then
Yeah.
you're like, okay.
True.
And then,
Yeah.
and then it actually probably hurts you in the long
Yeah.
run.
Yeah.
So, with testosterone dosing, I myself, I do multiple injections per week of small
Right.
amounts. And so you get less of those. And everybody's a little bit different. So, and that's why I think tailoring the method of delivery is it's a lifestyle. It's a feeling, right? How you feeling, and it's a lab value.
Yeah.
Right?
And I love that about pellets. It's the one route that mimics our natural secretion
Right.
Most closely
Right.
to what we would naturally secrete our hormones. So injections, you're going to have that quick peak and a quicker fall and, a little more labile. But with pellets, it's much more of a natural pattern.
So is there a preference?
Oh,
For,
see, that's the one thing that would resonate with me specifically.
What?
Yeah, just more natural.
Mhm.
I love that.
Oh, you love a natural.
yeah.
You love a natural.
I mean, I love a bunch of hormones and fillers and Botox.
Fillers and
too.
dichotomies.
Don't we all?
She's
Don't
like-
we all?
it's
I
called
think
a healthy
I want to
balance.
say I like natural.
It's a healthy balance.
Oh.
Roz, how do you feel about because I do see, just because we have so many providers, and I do see a difference of opinions when it comes to for female patients putting all three, test, estrogen, and progesterone, into a pellet form. I have some providers who don't particularly want to put all their eggs in one basket, if you will. And then I have other providers that are like, absolutely, like all day long, I will put a triple pellet in. Like it's nobody's
And
business.
is it boom, 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 3 different pellets, or is it compounded into one?
We
It's
use
3 different
ones.
pellets.
Okay.
Yeah.
So for my triple pellet ladies, that's what we call them. If they have no side effects such as expulsions, because usually with that triple pellet, that's where we see the most
And
adverse
when we say
effects.
that, we mean like the pellet, like working its way
way
back
up.
out of
Right.
the tissue. So, sometimes we refer to those as pellet rejections. And the thing about it is, it's our bodies, and we never really know what they're going to do or how they're going to act when we put a piece of something in.
Right.
So sometimes your body will kind of work it out, not because of anything wrong or anything like that. It just kind
Yeah,
of
but that's
sees it
not
as like a little
common.
thing.
But I
No.
usually do
Not common, but it
yeah.
a
can
second
happen.
track. If they have a triple pellet, I usually make a second track for
Right.
that one. Like
Yeah.
I'll do the testosterone and the estrogen in one track, kind of come out and
Right.
go with a
Then-
different
But
Yeah.
a lot of that, in my
direction.
opinion, is anatomical too.
Yeah.
And so,
Agreed.
some ladies that are in great shape, they have very little subcutaneous fat. Their rear ends aren't big enough.
Yes.
Not enough fat back there.
Mhm.
Some people are shaped a little bit differently. Their muscles can push and attach differently. So, you certainly can have a quote unquote complication with a pellet. They're very rare. Like infections are very rare. Can it happen? Yes.
Yeah.
I don't think anybody's body like truly rejects it. Like, oh, it's bad, but can push it out. Yes, because of anatomical considerations. Right.
And that's what I'm saying. Like, no, it's not common, but they
need to be aware.
When you're looking through things, yes, like it is a it could be a possibility.
Yeah.
But
and if the progesterone is doing its thing, no no night sweats, sleeping great, and you're getting your in pellet form, then let's stick that route.
Well, I was about to say, do you ever have, like, when you were talking about supplementing on top of the pellets, do you ever have patients and stuff that start bleeding when because that's a huge hormone shift that you're putting in.
Right.
And so you can have breakthrough bleeding and stuff like that. Do you ever supplement with oral progesterone at that time to kind of help that out?
Yes. And that's where we can kind of, like you were saying, a little supplemental. Because if you have a uterus, yes, breakthrough bleeding is always a possibility. It's not common, but it's easily addressed usually with some extra progesterone for that time period. So if they are a pellet patient, we would supplement, for a few days until it subsides.
And I'm going to go ahead and say it that we say every single show. I think this is why it's so important to follow up with an individual who does this, who specializes in this, because it is tricky, especially for females. Now we're talking about, guys, we can put pellets in them and, it's just test and they're just like rocking. But it's, with females, it's such a fine tuning. And I know we say it every single time, but it's so important to find that individual that you have the rapport with, that you can just pick them up and say, hey, Roz, I'm having some breakthrough bleeding. I'm not sure what's going on. Hey, here's some progesterone. Let's take this and then we'll redraw out, and it's like having that, because it's the way we feel. And I think it's so important to make sure that we are kind of walking that journey with that patient so we can figure out what it is that they need from us.
It's very personalized.
It is.
I have recently had a pellet patient. She was just getting estrogen and testosterone and had some breakthrough bleeding. And she was already on oral progesterone. So we just doubled her dose for a few days and wham, bam.
Yep. She was good to go.
Yeah.
You have to have enough junk in your trunk to put pellets in.
Why the heck did you not just do a progesterone pellet?
She likes her oral progesterone.
Because it helps her sleep?
It helps her sleep.
Okay.
I don't even think she's tried the pellet, the progesterone pellet. So we just stick to what works.
I mean, oral at night, easy.
Oral at night, yeah.
That's it. Okay.
Great sleep aid.
And you get that good progesterone.
Yes.
Sleep.
Yes. Sleep like a baby.
Yeah. Wow. Okay.
Yeah, I like pellets. I mean, I do find that there is a lot of the population out there that would benefit tremendously from doing pellets, but you have to find somebody who knows how to manage pellets, because you think everybody's always going to take the easy route. Everybody's always going to, I can manage injections. I can manage oral therapy, patches, creams, all of that stuff is super easy because, like we said, the half-life is so much shorter and stuff like that. But when you have somebody who truly understands what your body's going through and what those ebbs and flows are, and being able to monitor this pellet therapy, it is so great to have that like all married together.
It is. And I'm going to go on a limb here. I don't like patches. So
don't tell Taylor's
Really?
Yes. I don't like patches, but it's a whole, we're going to have a whole talk about that. It's just a bad idea.
I mean, some people are into it.
Some people are into it, but that doesn't mean it's right. I mean, some people are into it.
Hey, what's
just
right for
why,
you
though?
does not.
Truly, why?
Variation in the methods of skin thickness, absorption rates, and method of
Absorption
delivery.
is
There's such a big issue associated with patches. It's just, it's a good, for
But
something.
why are you going to tell me a patch is a different absorption than a cream? Like, I mean, it's the same.
Because you don't take a shower in your inside of your body, and you're not bathing, and you're not sweating, and you're not. I don't know. There's a lot of differences.
I don't understand that analogy.
I don't get it, but I also don't like cream.
I don't like creams.
Cream's gross. Yeah. Cream's gross.
I'm not saying those things are wrong, and they're good entry points. But if you really want to get good delivery and steady levels, you've got to go a little bit inside the body, whether it's oral, whether it's injection, whether it's a pellet.
Yeah.
All right.
I'm
just
honest.
being a doctor here. I'm going out of. It's
yeah.
not because you brought up patch earlier.
Yeah.
I'm not saying it's wrong.
This is why this is his side gig. No, I'm just kidding.
This just doesn't bother me, the patch thing. I'm sitting here.
I know.
I love
agree.
a pellet.
I agree.
I love
though.
injection, and I don't want an oral if it's right, if it can do it orally. The patches, I see a lot of Ooh, I don't know.
Also, you know me, I got sensitive skin.
All right, sensitive
I
skin.
have sensitive skin.
And
My
it falls
eczema.
off.
And I feel like, because I'm
they're
going to
freaking
reference
out.
this on
I was
the
about to say, then you can't get it. You
Yeah.
have to looking for it on the black market.
like
Yeah.
the
At 8 o'clock at
testosterone
night.
creams and all that. Like I've seen so many issues with testosterone creams.
Yeah.
You've seen it in patients. I've seen it in patients. And you got to slather like it all over your body. And most people to get enough testosterone.
can't.
I recommend it to my older patients.
Yeah,
like
look,
the
there's
creams.
it can happen.
You know, like it's not
And
all
I'm
bad.
saying,
Okay?
I'm
a
personally
little
on
more
a limb here.
conservative
Right.
Yeah.
replacement.
Well,
but
and the transmission. I mean, that's the biggest thing.
Cross
The
transmission.
cross
Yeah.
transmissions.
if you have young kids,
Yeah.
pets, I don't recommend
Yeah.
the creams.
It's
Don't
just-
tell your wife that you're doing test cream, and then all of a sudden
Yeah.
she's like,
Correct.
something
Yeah.
is happening. We have had.
All right, I'm going to shut up over here.
We've had females come in like, why is your test level so high? And
Yeah.
they're like, oh, my husband has cream. And I'm like,
Yeah.
oh, Sha, you have cream.
Yeah.
Yeah, you are.
Okay, so is there any other like pellet takeaways or anything of the sort that you would like to throw out there for all our, and like I said, this is for guys too. I just want to let you all know, like men can also receive pellets. It's just not as common because of the amount of pellets that you have to put
Yes.
in. And you know, guys don't want that, you know, it's because it's like 10 to 12 pellets that you have to put in that same area.
Yeah.
And most of the time men have a leaner
Leaner rear end.
booty than our girls.
Yeah.
Yeah.
So it's kind of harder to get into that
Yep.
the tissue,
Subcutaneous.
the sub-Q
Yeah.
tissue
Yep.
for that, and then it's not comfortable because you got to think you got to, you know, you sitting on
Yeah.
your booty.
Yeah.
I love
but-
them for what they do and for the appropriate patient.
Yeah.
Once you find that sweet spot of their
Oh.
dose,
Mhm.
Incredible.
they want to just hug and kiss you.
Yeah.
They sticky.
Yes,
They just
and,
stick to you after
and
that.
it is a little tricky, and I'm very upfront in our consults about that. I'm like, now, okay, we're this is our first time around. We may have to, you know, finagle a few things when we check in and find that right balance for you. You may have some breast tenderness or breakthrough
Right.
bleeding, or those hot flashes may not go away all the way.
Right.
But that doesn't mean, you know, that can't happen.
Right.
Yeah.
So it's just adjusting the dose. Once you find it, stay there until you have to move. And for my hormone shy girls who are just new to HRT,
Right.
I'd say go for it. If you are a busy mom and you know that you don't like injections, you're going to forget your pill, and you don't want to transfer it to your kids,
Yeah.
try the pellet route.
And I mean,
Yeah.
to start, you could do a more conservative
Absolutely.
pellet to start,
Absolutely.
and then just like you said, at
Ramp it
10
up.
weeks,
Yeah.
ramp it up.
Yep.
Yeah.
And that's usually where we start a little on the lower side
Yeah.
for like our
New
hormone
gals.
shy girls. Yeah.
Yeah.
Our new gals.
Hormone
Well,
shy.
Roz, thank you so much for joining us.
Oh, I'm happy to
and
be
don't
here.
worry, you will again in 2026. It's gonna
Uh-huh.
be great.
I'll see y'all soon,
It's
I'm
gonna be
sure.
great.
I'm sure. I was just telling Dr. Weiler, I was like, hey, this is it. So I won't be on camera
No.
anymore.
Not
you can't
true.
cash in once.
No, but
Yeah.
just don't be afraid of pellets. Stay off the internet on Google.
Yeah.
Like, just go to a licensed professional.
Yeah.
Come to us, obviously, and we'll be there every step
Yeah.
of the way, looking at
Yeah.
your labs
Well,
and
yeah.
getting
Do your
you
research, but
there.
give it a shot. You know?
Yeah,
Talk
Tell
to
us
somebody
right.
about it. Somebody who knows about it.
Yeah, somebody
Right.
knows about it.
Not WebMD. Somebody who knows about it.
Right.
absolutely.
Well, thank you, Rosalind, for joining us today. I hope you
Thank
have a
you.
lovely Mardi Gras, ma'am, and I hope you're doing something wild and fun.
I am.
I'm
not. I'll be at home.
Remember to follow us on all platforms. We are on YouTube. Subscribe.
below.
Wherever you listen to your podcast, make sure you give us a follow, and make sure you look for us on Instagram, TikTok, all the social media platforms out there. And remember to always stay curious, always stay informed, and always consult before you cut. We'll see you guys next week.
Bye.